So I am the current chair of the ESMO Patient Advocacy Working Group, which is a working group that has existed for a couple of years, but this is actually the first time that this group is chaired by a non-oncologist. So when my husband was diagnosed, the new novel therapies that we have heard so much about in melanoma weren't available yet. So the only way to get access to these new therapies was in clinical trials. And that experience with looking for clinical trials, having to join clinical trials, seeing the design of clinical trials was something that I found unacceptable, and this was my motivation to get started.
Mainly my role is about managing symptoms in the clinical setting. In terms of my teaching role, I work at the Cyprus University of Technology and the University of Turku in Finland. So my role is to teach cancer nurses how to become cancer nurses.
I'm the Norman Levan Chair of Humanistic Medicine at the Shari Tzedek Medical Center, where I practice in both medical oncology and palliative medicine. I see myself very much as a case manager to work with patients and families to try to combine together the very best of cancer care, as also with person-focused care to try to improve the patient's quality of life as best possible.
What I believe is important for patients is to be exposed to a care concept that is holistic, that is integrated from the first to the last contact. And I believe that nurses play a very important role in that, because they do spend a lot of time with the patient.
As the person who spend most of the time by the bedside, they have really the finger on the pulse as to what the patient is experiencing, and so they are an important part of the feedback loop.
Side effects can be quite important, and having someone who understands, who can help you deal with the day-to-day life makes a huge difference to the quality of life that our patients have.
Cancer nursing is not like any other field of practice. You have to know that the role of the cancer nurse has evolved over the years. So nowadays we see that the nurses are involved in roles that 10 years ago were unspoken or unthink of.
So from my perspective as patient advocate, what I would like to see is a close collaboration between the different medical professionals, like oncologists and nurses working in oncology.
Let's take, for example, a multidisciplinary team that is ill-prepared. There is no communication between the members. So the provision of care, it comes in compartments. So there is no link between the care provided. So that in any case will result in the patient paying the price of poor care.
The delivery of good quality palliative care is interdisciplinary.
So what I would like to see is streamlined and integrated care concepts, and also training that we're able to deliver that.
There's room for improvement in any setting, but I think that most multidisciplinary teams and interdisciplinary teams work very well.
I believe that the best cancer care that we can imagine is something that feels right by the patient.